My name is Janice Elaine Abels, and I am going to do an informative speech. And my topic is smoking takes your legs right out from under you. I want my audience to understand that smoking not only causes cancer, but can also cause diseases such as peripheral vascular disease. To people with peripheral vascular disease, the statement "standing on my own 2 feet" takes on a whole new meaning. Most health professionals focus mainly on cancer-causing agents of smoking, while vascular surgery specialists will tell you that the effects of cigarette smoking affect so much more than just the lungs. Smoking can take your limbs and possibly your life. I began working for vascular surgery in 2016. Since then, I've studied and learned a lot about the vascular disease. Many of the patients that we come in contact with from day to day are smokers or former smokers. I believe that if most people were better educated to fully understand the damage that they're doing to their bodies and to the vessels and arteries, they would choose not to ever smoke. I want to explain vascular problems that can be caused and how to find and monitor the status of each disease. You will learn that what smoking does to the limb of the body as well as the aorta and the carotids, and you will learn what atherosclerosis is and the tests and procedures to diagnose it. First, let's look at how many people are smokers. These are people who may not even know that damage is being done to their bodies. According to the statistics published by the CDC, cigarette smoking is the leading cause of preventable disease in America. More than 480,000 people die every year, which averages to about 1 in 5 deaths in America. 14% of people 18 and older were smokers in the year 2017. That was a decline from 20.9% in the year 2005. Smoking is a habit that can affect people of all different walks of life. Men are more likely to smoke than women, and people with disabilities or life-altering limitations are more likely to smoke than the ones who don't have any disabilities or limitations. Whether the effects are felt quickly or never at all, the damage is being done with every cigarette that's being smoked.
Miguel, you have a call?
Peripheral artery disease can affect the vessels and arteries in your body, but limbs seem to be affected much more often. It causes a reduction in the blood flow throughout the body that can lead to amputations of 1 or more limbs. It can also affect the flow of the brain and heart, leading to strokes, high blood pressure, aneurysms, due to vasoconstriction of the vessels, preventing blood flow throughout the body. As you see in these posters, our blood flows from the top to the bottom. There are many different vessels and arteries through our body. Many people don't even have symptoms for a long time, and when they do, they can be severe. Claudication is a symptom of cramping or pain triggered by walking, but it can be resolved after a few minutes of rest. It just makes life difficult. There's what we call cold leg. There's coldness that a patient gets in their leg, and there can be discoloration. There are ulcerations that are slow to heal because of tissue damage. Damage cannot be undone, but it can be slowed down so that the effects or symptoms would not be so life-altering. There are different things that can be done that may increase function and help with the relief from pain of PVD. So there's proper monitoring by a vascular specialist. Keeping up with annual or biannual visits to check for pulses and discuss any type of pain with walking or legs. Keeping a close eye on skin for discoloration or slow healing wounds. Ultrasounds and CTs for review by specialists in vascular studies. The different ultrasounds are called ankle brachial indexes, done on the legs and feet. Carotid ultrasounds done on the neck. Arterial upper ultrasounds done on the arms. Vascular ultrasounds for the abdomen to view the aorta. And there are ultrasounds for the mesenteric arteries also. There are CTs of the head, neck, chest, and pelvis that can also help find the disease or locate aneurysms in the body. Once the tests are completed, there are surgery procedures that can be done. The easy part is finding the blockages. Then you have to try to eliminate the blockage to restore or improve the blood flow. Arteriograms or aortograms can be performed on the arms, abdomen, and pelvic areas. A catheter is inserted into the artery with dye to look for the blockages found on in the test. Stents are inserted at times to help with the blood flow, and sometimes with the severity, there can be more than one stent. Endarterectomy is another procedure that can be done where the artery in the body is cut open and there is an incision made so that the blockage can be removed and then sewn back up. Recovery time for the catheter is probably most likely 3 days. It can be longer depending on severity of the procedure. Recovery time for endarterectomies can range from 3 to 6 weeks depending. I've always heard that an ounce of prevention is worth a pound of cure. So there are ways to prevent peripheral artery disease and save your limbs. Exercise can help your body flow where it needs to be sustained proper circulation. Walking 3 to 4 times a week for 30 minutes or more. Riding a bike 3 to 4 days a week, beginning slowly and working your way up to longer periods. Never smoking is the best choice, but if you're a smoker and you quit, it can decrease your chance of getting vascular disease. Within 5 to 15 years of quitting, the risk of stroke is similar to that of a person who has never smoked. The risk of coronary artery disease and vascular disease is reduced by 50% 1 year after quitting. Carbon monoxide levels drop within hours. So now you know that smoking can lead to damage to your arteries and cause a variety of vascular issues. Most people only think of cancer when they think of cigarette smoking, and I hope that you now know that peripheral artery disease can lead to stroke, possible loss of the 2 legs that carry you through your life, and the vasoconstriction of arteries increase with every cigarette smoked.
One more.
Thank you.
Okay.